So our next topic is Acnae Rosacea. Acnae Rosacea, as its name indicates, it is an acne which is red. So the first presentation of Acnae Rosacea is usually flushing of the face, and initially flushing of the face, and then later it develops into persistent erythema with papules and pustules. So erythema with papules and pustules, like papules and pustules, your diagnosis will be Acnae Rosacea. In acne vulgaris, papules and pustules are present, but there is no flushing or erythema usually. Acne vulgaris is caused by Propionibacterium acnes, while the cause of Acnae Rosacea, it is not usually known. Acne vulgaris is common in adolescent age group, while Acnae Rosacea, it is common in elderly people. And it can lead to disfigurement of the body parts such as rhinophyma. So someone with flushing of the face and papules and pustules and disfigurement of the nose, that is known as rhinophyma, your diagnosis will be Acnae Rosacea. What is the management of Acnae Rosacea? You can see in this diagram this redness on the cheek and in nose, and you can see the disfigurement of the nose as well. That is known as rhinophyma. So this is basically the presentation of Acnae Rosacea. The treatment is usually topical metronidazole. Remember that topical metronidazole and not oral metronidazole. So topical metronidazole is the treatment if mild symptoms are present. For more severe diseases, systemic antibiotics such as oxytetracycline, they can be used. Daily application of sunscreen is also advised. Camouflage creams can also be used and may help in corneal redness. Laser therapy may be suitable for patients with prominent telangiectasia. So telangiectasia is also a common feature of Acnae Rosacea. So telangiectasia is present and it is prominent, then laser therapy may be a treatment option as well. So topical metronidazole for mild symptoms, and if severe disease, oxytetracycline, and if telangiectasia is present, then laser therapy is the treatment of choice for Acnae Rosacea. So rosacea means red nose, red cheeks. Usually even after taking alcohol, there's redness of nose and cheeks. That is known as Acnae Rosacea. So that was all about Acnae vulgaris and Acnae Rosacea. Now our next topic is Pityriasis Rosea. In the previous lecture, we discussed a topic that was Pityriasis versicolor. So can someone tell me what are the features of Pityriasis versicolor? What does versicolor mean?
You mentioned that yesterday, that it means that it's like discolored or like can change color.
Yes, versicolor mean changing the color of the skin. So Pityriasis versicolor result in a hypopigmented area. Pityriasis versicolor is basically a fungal infection that is also known as Tinea versicolor, which result in the formation of a hypopigmented area on the trunk or on the skin, while Pityriasis Rosacea is a different condition. To remember Pityriasis Rosacea, you need to remember gutted psoriasis as well. So in the previous lecture, we discussed that there are some skin conditions which can occur after a history of upper respiratory tract infection, and gutted psoriasis was one of them. And the second one is Pityriasis Rosea. So gutted psoriasis and Pityriasis Rosea, they can both occur after a history of upper respiratory tract infection or sore throat. What is Pityriasis Rosea? It is an acute and self-limiting rash. So gutted psoriasis also is a self-limiting rash, while Pityriasis Rosea is also a self-limiting rash. So treatment is not required usually in both the conditions. So reassurance will be our only option if any of these gutted psoriasis and Pityriasis rosacea, if they present to us. Now, how we are going to differentiate between gutted psoriasis and Pityriasis rosacea? In gutted psoriasis, we know that there were teardrop lesions after a history of sore throat, while in Pityriasis rosacea, you can see that the lesions are just small, like the lesions of gutted psoriasis, but you can see this bigger lesion. This is known as herald patch. That is shown in this diagram as well. So initially, on trunk, there will be a herald patch. Now, what is a herald patch? Herald patch is an ovoid red scaly patch. You can see that this is an ovoid, oval shape, red and scaly patches. These white areas, they are scales. So an oval shape, red scaly patch that is similar to the lesions that subsequently appear, but is larger than these lesions. So herald patch that is followed by lesions that are small and red, giving the appearance of a fir tree. So remember these 2 points if you want to make a diagnosis of Pityriasis rosacea. That is, if the question mentioned that initially there was a herald patch and then, or if the question mentioned fir tree appearance of the rash, then your diagnosis will be Pityriasis rosacea. So herald patch and fir tree appearance is specific for Pityriasis rosacea. It is usually a self-limiting condition and it typically disappears after 4 to 12 weeks. So in this diagram on the left, a herald patch is seen, and after the appearance of a herald patch, after the few days, a more generalized fir tree rash appears. So that's why these 2 points are important to remember to make a diagnosis of Pityriasis rosacea. So Pityriasis rosacea, as its name indicates, it is redness or it is erythema, in which there is initially there is a single patch that is followed by a fir tree appearance of a rash, while Pityriasis versicolor, there was hypopigmented areas on the skin. Now, a more differentiating point between gutted psoriasis and Pityriasis rosacea. Both of them can occur after a history of sore throat, but this history of sore throat, it is more common in gutted psoriasis and less common in Pityriasis rosacea. The appearance of gutted psoriasis is teardrop scaly papules on the trunk and limbs. Simple as that. Teardrop scaly papules on trunk and limbs. And Pityriasis rosacea, herald patch, a single ovoid patch that is followed by multiple erythematous oval lesions with fine scales confined to the outer aspect of the leaf. So this is the difference between Pityriasis and Pityriasis Rosea. Both of the conditions are self-limited, so usually no treatment is required. But if no treatment option is not given in the option, then you can select topical steroids because they can be used in the management of gutted psoriasis. For example, as given in this scenario, a picture with rash on the back and legs, the patient had sore throat. So a diagram is given and the patient has a history of sore throat 3 weeks ago. So we know that there are two conditions which can result in a erythematous rash after a history of sore throat, that is Pityriasis rosacea and gutted psoriasis. We cannot find any herald patch here, so it is most likely gutted psoriasis. But they haven't asked us about the diagnosis. They has asked about the management plan of the rash. So we know that the management of gutted psoriasis, because it's a self-limited condition, so usually no treatment is required. So the best option is no treatment or reassurance. But if no treatment is not given in the option, then you will pick topical steroids. But if both of them are given, like in this question, such as no treatment and topical steroids, both of them are given, you will select no treatment or reassurance because the condition will resolve on its own in 4 to 5 weeks or 6 weeks. This is a more clear picture of the gutted psoriasis. You can see small teardrop-like lesions with white scales above them. So this was all about Pityriasis rosacea and Acnae Rosacea and gutted psoriasis and their management. I hope it's clear to everyone. So another condition that is related to skin infection is scabies. Scabies is caused by a mite that is known as Sarcoptes scabii. Sarcoptes scabii, it usually affects the children and young adults. This mite, it usually burrows into the skin and lay eggs in the stratum corneum, which is the most upper layer of the epidermis. So in the skin, it lays eggs, and then due to a type 4 hypersensitivity reaction to the mite itself or to the eggs, result in the infection of scabies, which result in itching, intense itching that usually gets worse after taking a hot shower, or that is usually worse at night. So someone with presenting features of itching that gets worse at night or after taking a hot shower with linear growths on the skin, then your diagnosis will be scabies. So these are some important diagnostic features for scabies. That is pruritus that gets worse after taking a hot bath with linear skin boros. The lesions are usually common in interdigital webs. So secondary features such as exocreation and infection can also be seen. Due to intensive itching, exocreation and infection of the lesions can also occur. The management is very simple. The first line treatment for scabies is permethrin 5%. Second line is 0.5% malathion. As well as you need to give proper guidance to the patients as well. Now, there's a type of scabies that is known as crested or Norwegian scabies. Crested or Norwegian scabies, crested or Norwegian scabies, it is usually common in patients with suppressed immunity, especially HIV. So if someone present to you with crested or Norwegian scabies, then the treatment option is the treatment of choice is ivermectin, oral ivermectin. Oral ivermectin tablets are used for crested or Norwegian scabies, while simple scabies is managed with permethrin 5% as a first line, malathion 0.5% as the second line.
I had a question.
Yes.
What do you mean by Norwegian scabies?
Norwegian scabies, it's the name is given to these scabies. It was common in uh, uh, Nigeria, I think. That's why the name given to this scabies on the basis of this area is Norwegian scabies. Otherwise, its medical name is crested scabies. That is, you can see these crust formation in the interdigital spaces. This is a typical features of this Norwegian or crested scabies. So in short, you can say that scabies with crust formation in the interdigital spaces, your diagnosis will be crested scabies or Norwegian scabies. Is that right?
Yes, thank you. Yes,
I
sir.
think the area is some village of Norway and not Nigeria.
Yeah, I was just going to say that.
Yes.
Okay.
So this was all about scabies.